Hello, thanks for joining us. I'm Brad Edwards. Holidays on the horizon, and one thought is holidays and illness. It's not something we want to think about, but we want to avoid it. And to help us avoid it is joining us now a longtime friend of the stream, Dr. Katrine Wallace. Many of you know her from TikTok fame and other social medias as Dr. Kat. She's with the U of I Chicago School of Public Health. Dr. Kat, we've kind of got this triumvirate of things happening right now. We've got COVID still kicking, flu kicking, and RSV kicking, which is another respiratory illness. Where are we at?
So that's correct. Hi, Brad. We have 3 respiratory viruses, and actually more, to be honest, but there's 3 major respiratory viruses that are causing increased hospitalizations and are circulating at a much higher rate this year than before. So what we have going on right now is, especially with the case of influenza, we have really, really high rates of influenza that are higher than normal for this time of year. So the trajectory week over week has been really high, and it's about a month earlier. We usually think about the flu as being like January, February timeframe, but we really started having high rates in November, which was unseasonably early and high incidence. So that's been concerning, and it is driving up hospitalizations. We've had pediatric hospitalizations for influenza this year. And so what I would say for that is that definitely it is not too late for people to get their influenza vaccine if you haven't already gotten it. It is a pretty good match to the circulating strains of influenza this year. So that would be my #1 recommendation for that. In terms of COVID-19, we are seeing a little bit less hospitalizations from COVID, certainly than we had last year at this time, but we still are having about 40 hospitalization admissions per day in Chicago due to COVID-19. So and also we have a bivalent booster available now for people, and the uptake on that vaccine has not been what we want it to be. So there's a primary series, which is the first 2 vaccines that people got probably back in 2021. And it doesn't matter if you have gotten any boosters at all. You are definitely qualified. If you've had those first 2 shots, you're definitely qualified to get this bivalent booster. And as you can see on the screen, these variants that are circulating now are still Omicron. So that's the good news, is this vaccine targets the Omicron variant. We call it the bivalent booster because it has a piece of the original virus and a piece of the Omicron virus. So it will protect you against these other variants that are emerging now. Oh, go ahead.
Yeah, so basically what you're saying, Dr. Kat, is not enough people, when you talk about uptake, not enough people have gotten the bivalent booster, the last. Therefore, we're still seeing an abnormally large number of Omicron cases.
So the booster so the bivalent booster will do a great job at protecting you from hospitalization, severe illness, and death. We know these vaccines are not 100% effective. People still get infected if they have the vaccine, but these vaccines are very, very effective at protecting you from getting severely ill. So the unfortunate truth is that only about 14% of people 5 and above have actually gotten their bivalent booster. So, and it's been shown that if you do get the bivalent booster, data came out from the CDC this week that it actually cuts your rate of hospitalization in half if you do get it. So it's highly recommended that you get it because it's a perfect match for the Omicron strains that are circulating, and it will prevent you from getting severely ill.
So when you're with family during the holidays. What are some things to mitigate? Because, you know, you could be carrying and not know you're carrying. You could be asymptomatic.
Right.
What are things to think of as we gather with each other this holiday season?
So what I've been telling people is that you should really think about who is in your circle and plan around the most vulnerable member who's going to be at your gathering. So if it's your 100-year-old grandma, or maybe your cousin just had a newborn baby and is bringing that baby to the gathering, plan around the most vulnerable person, and that kind of helps people to make an assessment of what they need to do. But this graphic that's being shown right now was done by the City of Chicago Department of Public Health, and I thought it was a really good one, that you can get your vaccines if you haven't already, mask up if you're going to be indoors around vulnerable people, back up, so social distancing, we know it works. If you don't need to be all crunched together, if you have space to give people a little bit of space, that works. Open up if you can open windows, or otherwise have a well ventilated space, we know that works. Wash your hands, and lastly, test before you go to gatherings. Even if you have no symptoms, you should do a rapid test before you go. That way, you know you aren't carrying an asymptomatic case of COVID. And one more thing I would add to this graphic is, if you are feeling sick at all, if you have symptoms at all, stay home. Because I know it's not fun to think about, but if you are, what might be a mild cold for you could be a hospitalization for somebody else. So you can't tell between all the viruses that are circulating at the moment what you have based on symptoms alone, because they are all very similar. So if you have symptoms, please stay home. If you don't have symptoms, test before you go. And we can now order tests again. From the federal government is now sending 4 more tests. The email address was on that previous graphic, or the website address, sorry, where you can order 4 more free COVID tests.
I like that. Pretty simple advice. Think about the most susceptible amongst your group.
Yeah.
Interesting thought. I had something I've heard recently. I got sick. Just had some friends get sick. We tested negative for COVID. We didn't have the flu, but it seemed like we were excessively sick for what would be a cold. Something that maybe seemingly 5 years ago I thought I would have kicked in 2 days, last for 3.5 weeks. Is there something to be said, like almost like we were in a bubble, a safety bubble for so long, masking and whatnot, that now we're almost more susceptible to what would have been a pretty common germ or virus 3 years ago?
So it's hard to say what you exactly had. There are a couple things going on. Number one is that we are seeing more severe strains of like the flu. This year's flu, I've heard, has really been knocking people out. So I don't know if that's what you had, but there are some more severe virulent strains of certain things that have been circulating. Secondly is there's been a concept kind of been discussed called immunity debt, that perhaps because we were keeping ourselves away, that our bodies somehow forgot how to deal with disease, or our immune systems forgot. And that is actually misinformation. What is maybe happening, and what makes a little bit more sense from an epidemiological perspective, is that the community had less population immunity. So what happens is, when enough people in the community are immune to something, the virus doesn't spread as easily as when it's not. So like when COVID, a novel virus, came out, no one had any immunity, so it spread like wildfire, right? But if the virus meets somebody that isn't susceptible, then it'll kind of stop there. And that's why we propose vaccination, because vaccination causes some kind of herd immunity. So it's possible that because we haven't been out, and because we've been kind of keeping ourselves away, that we don't have that same kind of community immunity here that we did before the pandemic.
What is the most concerning trend line you see right now?
So I think it's concerning that the hospitalization rates are being driven by children. The first group is 0 to 4 years old is the highest, and the second highest is 5 to 17-year-olds. So that is concerning to me, is that the hospitalizations are being driven by pediatrics.
Is that RSV? Is that lack of immunization, a combination of both?
So I think it is probably a combination of both. There's COVID hospitalizations, influenza hospitalizations. Thankfully, it seems that RSV is on the decline, but on its heels is influenza and COVID that are increasing. So it's like the pediatric ICUs aren't really getting a break between all of these going on. So yeah, I do think that more children need to get their primary series, because so we're talking about the bivalent booster rates before, but actually the 5 to 11 primary series, just the first 2 vaccine shots, only about 35% of kids in the US have gotten their primary vaccine series. So before we even talk about the bivalent booster, we need to get those kids up to date with their vaccines. So yes, I think kids need to get their COVID vaccines and their flu vaccines, because again, both of those vaccines are very effective at preventing severe illness, which can result in hospitalization.
Dr. Katrine Wallace, always great to hear from you, always insightful, from the University of Illinois, Chicago School of Public Health. We can find you on TikTok at what?
Epidemiologist Cat. And Instagram too.
Okay, sounds good. Happy holidays. Thank you for being a friend of the stream, and thank you for keeping us safe. And thank you for joining us. I'm Brad
Thank
Edwards.
you, Brad.
Yes. Now back to the stream.